Like everyone, I didn't know how bad the virus would be. Months ago, because I follow a lot of Chinese dissidents online, I started to see rather terrifying videos like this one coming out of China. I saw that entire Chinese cities, and I'm talking big ones, that entire massive Chinese provinces were on lockdown. Just how bad was it? I immediately thought of Chernobyl and the Soviet Union's cover-up of it, how Chernobyl was caused, how bad it was, how they dealt with it. If you haven't watched that HBO miniseries, I highly recommend it. So was the virus as bad as the Hollywood virus movies are? Were millions of people dying? So far, the publicly available information suggests that there have been about 150,000 deaths worldwide, but that Italy, Spain, France, and the United States have the most casualties. But I don't know about that. You just can't trust China on anything, really. As that wise young man from the streets of Hong Kong told our friend Avi Yamini last year.
Donald Trump, don't trust China. China is asshole.
Yeah, exactly. So for all we know, there might be 10,000, 100,000, a million, maybe millions more deaths in China from the virus. How would we ever know? The number of Chinese cell phone customers fell by 21 million recently. Now, did those 21 million people just really stop using a cell phone in our day and age? Were they too poor to keep their phones? I guess that's a possibility. Or did 21 million people just no longer exist? Like with Chernobyl, we won't find out the truth till the communists get out. But what we can trust pretty much is our own Canadian statistics, I think. There's actually a risk of over-reporting statistics in countries like Canada and the United States. Here's a mainstream report from the U.S. that shows for every patient in Nebraska, the state gets $300,000 in federal money. It's a pretty big incentive to keep the bad times rolling. Then there's the curiosity that almost no one dies of this virus on its own. The vast majority of deaths involve some underlying health precondition. That doesn't mean those deaths aren't real or that the virus didn't cause it, spark it, but it means counting's a little bit tougher. If someone dies from a heart attack, but they also had the virus, which do you count? But it's fair to say we're over the hump here in Canada, at least in a lot of places. Our hospitals were cleared out of everything. Everything elective was postponed. That means surgeries that weren't emergencies. By the way, elective surgeries can still be to fix something uncomfortable or painful or dangerous. Things that if left unchecked could become an emergency. So it was a great inconvenience, and that had a public health cost to it too, let alone the disruption in people's lives and businesses. Everything went into lockdown mode. And then nothing, or almost nothing. Some jurisdictions released their public health models. A model, by the way, isn't really a prediction in itself. It's when you put little guesses or predictions on paper, really, how quickly the virus would spread, how many people who got the virus would be in serious condition, how many would need to be hospitalized, how many would need intensive care, how many would need ventilators, how many would die. Each of those links on the chain is a guess. Any model just combines all of the guesses, and you can have different ranges. It might be between this and this amount and that amount. So it was all guesses and then guesses about guesses. And as you can see by Ontario's guesses, it was a pretty sobering thing. But given the cycle of this virus, these models would be tested pretty quickly, wouldn't they be? I mean, it's not like the doomsday would be years away. It was measured in weeks, and thankfully, every single model in Canada and the United States was overblown. Every single one of them exaggerated the danger. And we learned things too. Things that we saw early from Italy a month ago, like, for example, that almost no one under 20, under 30 dies from this. Almost no one. It's very serious for people over 80, quite serious for people over 70, serious for people over 60, and I'm getting close to those numbers personally. But like I say before, if you have an underlying risk, you're at risk, but thank God none of the models came true. And even the deaths that did happen were clustered at specific indoor places where people were cooped up together, like the seniors' home in Bobcaygeon, Ontario, that David Menzies visited, where more than 30 people died. There were specific reasons for that particular cluster. I won't get into that now, but my point is, those were actually the anomalies. The norm is that this virus wasn't actually that deadly, and had none of us heard about it, had none of us been warned about it, and we would just heard of a bad flu and some deaths from it, most of us, the numbers might have been hidden among the regular toll that the flu causes. I don't think anyone would have noticed. We have a lot to learn from this all, and we're not done learning, but the disaster didn't hit medically. But it has been an economic disaster. The economy shrank by 9% last month, the largest in Canadian history. Our unemployment rate isn't officially posted yet, but it's surely in the 20% range. Again, that's as bad as it ever got in the Great Depression. That's where I think the real disaster lies. But hopefully we can get back on track. We still need to take care, but we can focus on the vulnerable, not the invulnerable. Kids should go back to school like they are in Taiwan. Wear masks, sure, yeah, good idea. Restaurants can open, perhaps with little clear plastic dividers in a fast food restaurant like they do in Taiwan, the kind of plastic dividers you now see at a grocery store's cashier. I think it's probably a good idea to have little masks on in public for a while, certainly if you're in close quarters, like if you ride the bus or a train. But we can get out of panic mode. We just need to start making our own masks, I think, and stop importing them from China. I don't want globalist authoritarians like Theresa Tam to tell me how to live anymore. I don't want globalist authoritarians like Justin Trudeau to tell me what to do anymore, especially since he himself flouts the rules, typical. And that, my friends, is the next phase of the battle for ordinary people to return to our lives and work after the high priests of public health, the WHO bosses, the government busybodies have had their time to shine, their moment of glory. They love control. I think that's the difference between a medical doctor who practices medicine on individual patients. He's got advice. He wants to help. He can even cajole, but at the end of the day, he's just an advisor. You, the patient, are the boss, and the doctor's trying to help you as an individual. But public health doctors who don't have individual patients, who don't limit themselves to tools of persuasion, but rather have power to order things, to demand and command, and not to treat us as individuals with individual needs, but to treat us more like ants in an ant colony. Those public health authoritarians have been running the show for the past month. Time for them to go back to obscurity. Alas, power corrupts, and absolute power corrupts absolutely. And they've been running with pretty close to absolute power the last month, not just the public health officials, but of course politicians too. Dominic LeBlanc, Trudeau's old friend, part of his wedding party, his henchman in Parliament, actually proposes to bring in a new censorship law to stifle conversations about the virus. Trudeau himself is resisting recalling Parliament, even in a reduced MP kind of way. Every other parliament in the world is meeting in some manner or another, even if it's reduced quorums. Trudeau prefers to rule by fiat. I mean, he told us his thinking 7 years ago on this, and he told us his role model for this.
There's a level of admiration I actually have for China, because their basic dictatorship.
Yeah, that's Trudeau's way. It's pretty evident. So that's the next battle here. The first battle is going fairly well. The war against the virus isn't won, but we've turned the corner in many provinces, and hopefully will soon in Ontario and Quebec too, thanks to the real doctors and real nurses there. The next battle, reigniting the economy, that's going to take longer and will have real pain, especially since Trudeau did his best to sabotage the economy for years, attacking oil and gas, blocking pipelines, allowing the sabotage of railways. Even without the virus, things were bad. I think we were heading into a recession. It might not be possible to simply pick up as before. I think America is a better place to do that than we are. We'll see. But the biggest battle politically will be that of civil liberties and limited government. And by that I mean getting out of this emergency state of mind for politicians and bureaucrats, tamping down the petty tyrants who for a moment lived as major tyrants. The censors, the people who thrilled at putting all of us under house arrest, the people who want to abolish Parliament and pass laws by fiat, the media party, worst of all, who approved all this just as long as they were cut in on more bailout money. That's the big fight. In the short run, it'll be cops giving out tickets to people who are just sick of the BS and want to go back to work, or families who just want to go hiking and get out of the house. That's the small stuff, and we'll help fight that through our civil liberties campaign. We call it fightthefines.com. We're already representing 3 or 4, I think, families who've had outrageous fines like that. I'll tell you more about those first cases on Monday. If you want to learn more, go to fightthefines.com. If you have been given a ticket, you can tell us your story and we'll give you a lawyer. You can also help us pay for the lawyers at that website. But the bigger fight is with politicians who got to spend more than ever, who got to give orders more than ever, who got to run the economy in ways they never dreamed of before. People who tasted power and like the taste very, very much. That's the longer fight, but it's a fight we're built for here at Rebel News. Don't you think? That's an excerpt from my daily show, The Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.